Okay, so we're getting into 50 and 50, 50 vlogs in 50 days. Thanks to Netix again for supporting these. I did calf scour and I got 3 emails, questions about oral rehydration therapy, and I think it's probably a topic on its own, so I'm going to deal with it today. If I look at it, and I'm interested in the evolution of medicine, animals and humans, you know, we look at antibiotics and vaccines typically over the last while and what they've done. But I suppose the key ones really for me were obviously sanitation, but hygiene. And a lot of you will hear about a Hungarian doctor at the moment called Ignaz Semmelweis, who discovered that washing hands could reduce childbed fever back in the 1800s. And he was sort of scorned for this idea at the start, but he was the godfather of this hygiene movement that we're now really learning about. It's an interesting read. Again, I digress a little bit, but one of the other massive I suppose evolutions in medicine, animals and humans, was oral rehydration therapy, because dehydration causes such problems. Now on farm we often think about diarrhea, and scour is probably the most common one, and that rapid fluid loss with calves losing 6 to 8 litres. But it's other things like shock, particularly a good example for dairy farmers is endotoxic shock from E. coli mastitis. But you know, your freshly calved cow who's not really eating or has other diseases, supportive fluid treatments work really well. So fluids really important. You know, if you think about your scours, what's happening, and I'll say this maybe a couple of times, but you know, the appetite's going down, energy's going down, you need for that glucose and energy. Acidosis are really important, I'll talk about that there. But because of dehydration, we see other issues. Because fluid loss in the body of calves in particular, they get cold, all other body functions slow down. Again, septicemia, bacterial infections can occur because of this dehydration. The body comes under pressure. So if we look at fluid loss, what's happening? We need to rehydrate the animal. We need to get fluids in there. And it's not just as simple as putting water in there, because if you put water in, it's not going to be absorbed quickly. There's very important things like electrolytes that need to go in, and these electrolytes play a key role in the basics of cell function. So sodiums, potassiums and chlorides. Again, if we're losing fluids and losing appetite, energy needs to go in there in the short term to boost and keep that animal going. But a big one for calves in diarrhea is acidosis. So our blood pH is always about neutral in animals and humans. And if we get a fluid loss through the type, like with scours, we lose a lot of bicarbonates, which makes the pH drop and go acidic. And that acidic pH affects blood pH. And that's why we see a lot of severe symptoms in calves, like the sluggishness, slow. And that's what often can cause the cardiac function to come under pressure. So it's a really important one with calf scour. How do you know if a calf has acidosis? I used to always use very simple things, you know, how bright is the calf? The eye in particular I used to use as kind of those calves getting sluggish, the more sluggish. And obviously when they're down, then that's a much more different story. So how do we measure dehydration in animals on farm? Look, on very basic terms, I think, you know, instinct is very good, but you know, skin tint, pulling out the skin of those calves, and it should recoil quickly. You know, any slowness in that skin going back into normal position, so pull it out, it should flick back into place. If we have a slowing of that down, that's a sign that, you know, that calf could be 5 to 8% dehydrated. Another really good one, again, it's instinctively done by farmers, is the eye position. So that eye should be flush with the lower lid. Any sinking of the eye back in on bilaterally on both eyes can be an indication of pretty severe dehydration. And again, now we must make these calls, and you work it with your own vet obviously, but making the call of whether the calf is up, whether the calf is down, how severe that is. But there are 2 really simple things, the skin tint and the eye position, that we can get good at on farm. Okay, so how do we give fluids to animals? You know, your stomach tube is your typical one with calves, really good tool. But cows can also get oral fluids through stomach pumps. And I think really transformed, when I was in practice, the oral stomach tubing of cows is kind of routine for any diseases. And now, depending on the disease or the metabolic status of the cow, it depends on what you're putting into that. And I had about 5 or 6 sachets for different things like acidosis, just for rehydration in cows. But they're very valuable. A lot of my farmers started using stomach tubes themselves, stomach pumping fluids into cows on their farms, and found the tools good, because dehydration is a big factor in disease if we can reverse it. And then again, it's all those extra little bits like energy, reversing any acidosis that might be occurring, really important. Now when it comes to intravenous fluids, incredibly valuable for the animal that's quite dehydrated. Again, this is specialist stuff with your vet you need to be working with. And I was in the veterinary practice, and their standard protocol for every calf with scour was a slow 5 litre drip. That's every calf got 5 litres. And that's the kind of, you know, it's plus 3 to 5 litres in calves. that you'll be looking at for rehydration. Okay, so that's, I suppose, just how we get fluids into animals. But oral rehydration is such a useful tool on farms that we can utilize it. You know, with calves in particular, we want to reverse that fluid loss. We want to get something in energy wise. We want to get electrolytes in and get acidosis. So there's real science to these electrolytes. And if you look at the gut of the calf, the fluid's just getting across the lumen into the bloodstream. There's a couple of things that are required in that process. You know, sodium is really important to get in there, but how sodium is transported across the gut wall, it needs other agents like potassium and chloride. And we talk about a SID value in electrolytes, that they're balanced. There's actually a very specific millimole, so most of your electrolyte solutions will have that. Something like an alkalining agent, because if we have acidosis, we need to reverse that acidosis. Something with energy like glucose in there. And then we have things like gelling agents, probiotics. But really key is that we get the osmolality right. You know, if you're getting a sachet and it's to go to 2 litres of water, not 1.5 litres, not a litre, it's mixed up correctly. That's really important. Some people will use their homemade electrolyte solutions, which can be done, but where I've seen them fail is just a spoon here, a spoon. You know, there's very specific guidelines you need to follow there. But electrolytes, there's a lot of science to them. They work really, really well when they're used early. Okay, so that's just, I suppose, really, there is science to electrolytes. So if I was to pick up key messages on oral rehydration therapy, early. That's the key message. Spot the need for rehydration early. Don't be in doubt. Just pull that stomach tube out, pull the fluids out, and use them if need be. The right mixture, just make sure that if you're using sachets, that they're mixed up, if they're say to 1 to a litre or 1 to 2 litres more commonly. And then how regularly we give fluids. So calves in particular can take quite a bit of feeding. Two of the questions were, how often do I feed electrolytes to if I have calf scar? So if you're feeding milk in dairy calves or calves around cows, you want to be aiming for 2 electrolyte feeds in the 24 hours. Keeping them separate is my personal preference to milk feeding. So, and you're looking for that 2 litres maybe before mid-lunch, late morning, early lunch. And again, repeating that in the afternoon or later evening, that you're giving those calves 4 litres of balanced electrolyte solution along with milk. And the question keeps coming up, should I take calves off milk? You know, I get better results. No studies have shown that removing milk is a good thing for calves. Milk contains 87% water, so you're with the fluid loss, you're continuing that fluid rehydration therapy with milk itself. It's got electrolytes, it's got energy, it helps the gut heal. I just think calves need to stay on milk, but the fluid loss can be so rapid, you need extra electrolyte feeds. Aim for 2 litres twice in the day as well. So that's some of the key messages I hope I captured there on oral rehydration therapy. If I think about my thought for today, I suppose we're living extraordinary times at the moment, and you know I suppose we're lucky here in Ireland at the moment that the hospital systems haven't been overwhelmed yet, but you know they're getting to be very busy places. And I just thought this morning about farm safety. I mean, I thought about thinking about our own house. None of us want to be and end up in hospital, obviously sick with coronavirus or anything else. But you know, just be that extra bit careful on farm. You know, often when we're rushing, making bad decisions, taking chances, that's when accidents happen. You don't want to be in hospital. You don't want farm accidents. You want to farm safely all the time. But at the moment, just stop before you take that chance. Just farm safely. Stay safe, everybody. That's my key message for today. So that's it. That's 50 and 50, and who knows what topic will come up tomorrow. I hope you're enjoying them, and all feedback. I'm taking some feedback through emails at the moment. So if any topics you want me to cover, or any feedback on some of the stuff that I have covered, let me know. Thank you.